What burnout is looking like has changed. Now we are seeing increasingly atypical features of burnout. You're checking your phone multiple times per night. You might be experiencing atypical burnout.
What are the symptoms of burnout then? How do I know if I'm burnt out?
The interesting thing about burnout is that the definition is changing. Earlier, when you think about burnout, yourself might think like, oh, I know what burnout is. I don't have it. A lot of people feel this way. Classic, typical symptoms of burnout: apathy, lethargy, feeling unproductive, not very motivated. In 2020, 2021, and 2022, what burnout is looking like has changed. It is no longer these classic, typical symptoms. Now we are seeing increasingly atypical features of burnout. In one study, 60% of people with burnout had an inability to disconnect from work as their main feature of burnout. You could be that person who is engaged in work and can't shut off, and you're thinking to yourself, this can't be burnout. I'm totally, engaged in work. In fact, I can't shut off my brain. You might be experiencing atypical burnout.
Atypical burnout. Because when I think of burnout, I think of like not getting out of bed and losing motivation. But you're telling me that my addiction to work might be a symptom and a sign of being burnt out.
That's right.
So how do I know? Because I'm addicted to my work. I love my work.
You know when it is different from your baseline. You love your work, yes, but you also make time for sleep, relationships, and connections with loved ones. It is not interfering with your day-to-day life, so to speak.
Okay.
So when you are feeling that sense of inability to unplug, that means you're checking your phone multiple times per night because you feel like you have to keep up. You are trying to keep up in the hamster wheel situation where you just can't. And often people don't recognize that it's happening to them simply because the face and definition of burnout is changing.
How many people are burnt out?
There are lots of studies on burnout. One big study, it was done on parental burnout and found that 2/3 of parents have burnout.
2/3, Jesus, 66%.
2/3, yeah. And that is probably underestimated and certainly underreported. There's also a lot of stigma and shame around burnout, so people don't want to come forward and say, hey, I might be stressed or I might have burnout.
If I have that atypical burnout, why does it matter? If I don't feel like there's anything wrong, if I'm successful in my work, what is the case for making a change?
So I've had lots of patients. I had a clinical practice in Boston, and what you're describing is the, young entrepreneur. So many patients who are young entrepreneurs. And the question I would always ask them is, what's your end game? So is it a sprint or a marathon? Are you looking to do this for 2 years and you love it and then that's it? Or do you want to think about what your life is going to look like 10, 20, 30 years from now? And so they would think about it, ponder, and then say, yeah, I want to spend time. My end game is that I want to lead a great life and I want to live until I'm 75 or until I'm 100. Burnout is not conducive with this idea of longevity and having that long life.
As you say, you can do that intensity, but you can't do it consistently. For me, is the really clear cost to that is you just play it out, zoom out on your life in 10 years' time, something's going to be broken.
Human beings, we don't have an unlimited amount of bandwidth. There is a discrete amount of bandwidth that we all have, mental and physical. And so if you are not getting the proper rest that you need and you're not sleeping as much as your body and brain need, and it's not about you as in personal, I don't need sleep, I only need 4 hours. I've also had many patients who've said that to me. But your brain and your body do physiologically and biologically need a certain amount of rest simply for the cellular function to continue.